Common table tennis injuries and how to prevent.
Part 3: Most common injuries and pains in table tennis.
Most common injuries and pains in table tennis.
In table tennis, we can divide the injuries by its position on the body. Therefore, we have injuries on the upper part and on the lower part. Injuries of the upper part are the most often because of the overused muscle. Due to the complex anatomy of the biomechanical properties of table tennis shots, it's very hard to understand the interaction between several muscle groups.
Upper part injuries: wrist, elbow, and shoulder. Lower part injuries: ankle, knee. Here we will discuss the common injuries, diagnostic and treatment methods.
In terms of injuries frequency, here is the top 5 most common injuries and pains in table tennis. 1. Wrist injuries.
2. Ankle injuries. 3. Knee injuries. 4. Elbow injuries. 5. Shoulder injuries. 1. Wrist injuries.
In table tennis, wrist injuries are very popular because the wrist is a very weak energy connection. Wrist injury is associated with ulnar pathology associated with the extensor tendon of the body and occur during backhand strokes.
For the forehand stroke, we don't use often the wrist. Bending and wrist extension are important components of the speed of the ball for the backhand flick technique. The speed of the ball in the backhand flick depends on the wrist angular velocity. Therefore, you can reduce the wrist injuries by reducing the wrist flexion and extension. It will help to reduce the dynamic repetition of this stroke. One way to protect your wrist is by using a wristband, for example, from Adidas. A wristband is also useful to absorb the sweat. There is a very nice designed colorful wristband for sport, both male and female players. Another good option is Neo-G wristband, support for joint pain, arthritis, sprains, strains, instability in racket sport, table tennis, golf, tennis, or basketball. 2. Ankle injuries.
Ankle injuries are very common for veteran players. It could be due to the bad choice of footwear, bad footwork techniques, and lacking a warm-up routine. Your shoes should have excellent grip and should keep you low to the ground. You don't want a shoe with a too high heel. In table tennis, you have to move quickly and do a lot of lateral movements. That's why you should buy a shoe specifically designed for table tennis, because these shoes are built for quick movement and protection of ankle. You need also to learn the right warm-up routine. This warm-up can improve the strength and flexibility of your ankle joint.
Finally, improve your footwork.
Learning the right footwork will help ensure you have the coordination to properly move around the court in a safe and effective manner. Work with a coach and don't neglect your footwork drills. A good warm-up is necessary before starting to play. The warm-up involves 5 to 15 minutes of light physical activity to raise your heart rate and make your muscles warmer. Then do some gentle stretching to complete the warm-up. In general, table tennis players just want to keep playing even having an injury and strain.
To do that, you should consider using a wrist strap and ankle supports. It can help you prevent the worst injury due to your ankle weakness. Some of my players just used the ankle and wrist supports and then they never looked back. It's good news for table tennis players.
Three, knee injuries. The knee is a much stronger energy connection than the ankle. Therefore, knee injury is less common in table tennis. However, knee requires a lot of liquid, so you need to warm up your knee carefully. Knee injuries are common in other sports. The writer's knee is a disease that can affect anyone who bends a lot, such as running, walking, jumping, or cycling.
Knee ligament tears may result in sudden knee pain.
It is felt as pain around the patella and may be the result of excessive use, injury, abnormal leg or foot bones, and weak muscles. To minimize the knee injuries, you should warm up your knee before the competition. You can also buy a knee strap. This helps to fix kneecap and minimize pain or soreness under or behind the kneecap. Wang Hao and Zhang Jike are using the Mueller Jumper S knee strap. There are two colors, red and blue, that you can choose. If you forget to stretch your knee, you can sometimes get clicking laterally too. Here is some quick advice if you get the knee pain in table tennis: stretch before playing. Wear a knee strap. Ice the knees after playing. Take fish oil. Cod liver oil can be beneficial for muscles, blood vessels, and joints. Do exercise to strengthen the knees. 4. Elbow injuries. Yes, elbow injuries in table tennis are very similar to golfer's elbow or tennis elbow. Less experienced table tennis players or recreational players generally experience elbow injuries due to improper technique, while professional tennis players can be injured in the elbow as a result of forced strokes, too hard striking. Often linked to a bad forehand technique, table tennis elbow is the obsession of amateur players. To reduce the risk, you need to apply power from the ground concept. A table tennis elbow is an inflammation of the tendons that connect the hand to the elbow and serve to flex the wrist, epicondylar tendons. Result: a pain in the elbow, awakened by the setting intention or the rotation of the wrist. Five. Shoulder injuries. The shoulder joint is the most mobile articulation of the body in table tennis. The waist joint generates a lot of power, and the shoulder is the connection between the trunk and the rotation axis, arm-forearm. Table tennis players tend to use a lot of power to create a powerful forehand attack. The amplitude and the rotation movement helps also stabilize the large strokes, like forehand smash. Shoulder injuries due to excessive use are common among table tennis players of all skill levels. It accounts for around 10% of table tennis injuries. However, repetition of the abduction extension movement may alter the arc of rotation of the shoulder, producing an increased degree of external rotation to the detriment of tightening of the posterior capsule. This is the case of Lu Guoliang. He has been operated to fix his shoulder due to moving up his shoulder during the forehand smash, with short pips, in his career. Shoulder and arm injuries are very common in table tennis due to the repetitive motions players use, for example during the forehand topspin training. During many years of training, without a correct relax phase, your shoulder muscle will suffer. Due to the intense training or the ambition to play in the tournament, some players train non-stop. When injured, they use the wrist, knee, and shoulder supports. If you have arthritis or other complications, then you should use support. However, if not injured nor prone to injury, you should not use support. It's not necessary.
Read more about table tennis on my blog, pingsunday.com. Get free ebook and coaching advices. See you in the next video.